Ask any question during the session can ask. ठीक है? So my topic is women mental health. आप सब लोग पीठ से हैं, किस डिपार्टमेंट से हैं? Dermatology. चलें, but I'm seeing that there's more females over here, but this topic is not only for females, it's also for males as well to learn. You fine? Okay, so there is a well-known book by the name of Men Are From Mars and Women Are From Venus. Right. Let's see. Men are motivated and empowered by when they feel needed. Women are motivated and empowered when they feel cherished. Is it so? ऐसा है? So there are so many roles that a woman has to play, and these are multiple roles. Women are indispensable in society and corporates. Women are overloaded. Women carry the triple burden of productive, reproductive, caring work at the same time. WHO has identified this. The situation has been found to cause women considerable amounts of stress and is normally referred to as role strain and conflict or the superwoman syndrome. Do you agree with that? I hope so. आप सब लोग ये रोल प्ले कर रहे हैं, ठीक है? Throughout their lifetime, women are more likely to be affected by stressful events and traumas, especially in relation to physical and sexual abuse, which can cause serious physical and mental repercussions. I think there is need to establish services for women mental health. And why? Let's see why it is important. Because the mental health issues are underrated, and these are mental illness in pregnancy, motherhood and pre and postnatal care, postpartum depression, which in Pakistan is ranging from 28% to 63%, placing it among the highest in Asia. आप लोग पीच से बाहर रिलेटेड बातें कर रहे थे, लेकिन दिस इज समथिंग वेरी इम्पॉर्टेंट. ये एरिया क्यों इम्पॉर्टेंट है हमारे लिए? बिकॉज ड्यूरिंग दिस पीरियड एंड द पेशेंट सफरिंग फ्रॉम पोस्टनेटल डिप्रेशन और साइकोसिस, द लाइफ ऑफ द चाइल्ड इज एट स्टेक. क्या होता है उसमें? You have heard about infanticides? Mother takes life of the child. आप अखबार में कुछ ऐसे पहले की बात है, अगर आपको याद हो, अभी few months back there was a report on TV that in Rawalpindi cardiac unit or some hospital, the nurse saved the child. The mother was trying to kill the child. और वो एकदम से हाईलाइट हो गई. हमें भी यही कहा जाता है, लोग ये समझते हैं कि लोग की माँ ने अपनी बच्ची की जान लेने की कोशिश की, लेकिन ऐसा क्यों हो रहा होता है? Because the person is going through lot of stress. उनको पोस्टमार्टम डिप्रेशन डेवलप हो सकता है, पोस्टमार्टम साइकोसिस डेवलप हो सकता है, एंड दिस हैज गॉट फर्दर रिपरकशंस. पेशेंट्स आते हैं, उनको ये थॉट्स ही आती है तो दे कैन कॉज प्रॉब्लम. दे गॉट ट्रीटेड, एंड आई नो समवन जिन्होंने ये बात अपने हस्बैंड को बताई कि मुझे ये थॉट्स आई, एंड एट दैट मोमेंट हस्बैंड थॉट इफ दिस विल मे हैपन अगेन, तो ही डिवोर्स द पर्सन एंड टुक अवे द चाइल्ड. So many things that are happening. हम सिर्फ एक चीज देखते हैं और फारिग हो जाते हैं. These are the neglected areas. Care and custody. So care and custody. Somebody has to do it. केयर एंड कस्टडी ऑफ द चाइल्ड. अभी जो मैंने आप लोगों को एक एग्जाम्पल दी है, उसमें देखें जब किसी को मेंटल हेल्थ इश्यूज आते हैं फीमेल को, तो क्या होता है? सबसे बड़ा मसला ये आ जाता है कि इज द पर्सन इज एबल टू टेक केयर ऑफ द चाइल्ड, एंड व्हेन देयर इज अ सेपरेशन बिटवीन पेरेंट्स, हु इज गोइंग टू टेक कस्टडी ऑफ द चाइल्ड? मोस्टली क्या होता है, अगर किसी पे ये एलिगेशन लगता है कि समबडी इज सफरिंग फ्रॉम साइकियाट्रिक इश्यूज, उसको नहीं दी जा रही होती कस्टडी, और उसको मदरहुड से डिप्राइव कर दिया जाता है. अभी जो मैंने आपको मिसाल दी वो भी यही थी. That person was perfectly alright later on, but she just discussed that during that period I had these issues and the husband divorced the person. And she had so much guilt and regrets, I should have not told him. वो एक confident relationship को समझते हुए उन्होंने चीज़ share कर ली और problem हो गई. So there are so many examples of these kind of issues. Trauma and domestic violence, which is also an underrated mental health issue, women mental health issue. Child sexual abuse. Why it is mentioned over here? Because this number, we are seeing the women who have faced these issues in their early childhood. And then later on they are presenting different psychiatric disorders. Their vulnerability is more. Stigma, they are facing stigma and victimization. Differences in presentation of some mental health disorder. They are different from men, so there are differences in presentation. So not only do men and women communicate differently, but they think, they feel, perceive, react, respond, love, need, and appreciate differently. So we have to understand that they are two different entities, and they should think about this thing, that they are different, but they can understand each other if they understand these issues. So the statistics show that you can see over here. Somebody's here. Is there anybody who can deal with this IT situation? Because I don't know how to connect it. You can see over here that there is a difference in presentation of different disorders. Anxiety disorders are in male with different age groups, like 12 to 17 years, 16 to 24 years, and the same age groups have a different number. The number is increased in females. You can see the number in 16 to 24 is more as compared to this number in males. And same goes for major depressive disorders. The number is double as compared to males. So the females are suffering more as compared to male. We are not saying that male don't need any help, but the females do need help, and because they are in more number, they need more help. Substance abuse, you can see that number is also there, but it is less than the males. General population survey in USA revealed that about 1/3 of all married women can experience some form of physical abuse during their marriage. Sexual harassment affects 1/4 of half of women employees and students. About 1/5 of adult women have been raped. Many women also suffer from the effects of abuse experienced in childhood that I have already discussed. Sexual abuse, defined as any sexual contact from fondling to intercourse, affects 20 to 30% of all girls. Physical abuse of girls with injury or injury potential affects approximately 10 to 20% of American women. So this slide is very important to understand. Has anybody got any idea what are DELIs? Okay. This is disability adjusted life years, and this is an indicator for global burden of diseases. WHO published a report, and then this idea came from this. What happened? From this report, it was identified that depression is going to be second birth by 2020. And before this, roadside accident and cardiac diseases were first and second in number. So DELIs are you can say, a measuring unit, how the disease is affecting the whole society. So we can get the idea from this. So we can also see over here that 1.2 million Delhis are affected when the women are suffering from depression. As compared to men, this is 0.49. And the same goes for anxiety. For women, this is 3.8, and men 0.21. So this is a big number showing why we are asking that women mental health services should be enhanced. They should be given separate clinics for this purpose so that they could come up and get the treatment. The three most prevalent mental health conditions in the society are anxiety disorder, 49%, and then depression, 24%, and emotional difficulties, 20%, is reported by a study. Based on epidemiological data, we can see the number of women is more as compared to men. वैसे हमारी population में what is the number of females in our Pakistani society? Does anybody has got any idea? Now the number by 2023 it is like 49.6 and 50.4 is males. In Pakistan, societal attitudes and norms as well as cultural practices. You might have heard about karokari, exchange marriages, dowry system. They play a vital role in women's mental health. Kyun? Do you have any idea? Anybody belong to these kind of regions? पंजाब में कुछ चीज़ें होती हैं, वो क्या होती हैं? कोई नाम लेगा? अपनी जुबान में नाम ले सकते ना? जब शादी होती है, कौन सी शादियाँ होती हैं प्रॉब्लमेटिक हो जाती हैं? बट्टा सट्टा। एक और चीज़ होती है, इसको हम क्या बोलते हैं? कुछ और इलाकों में ट्राइबल कुछ एरियाज में जैसे वन्नी का काम होता है। वन्नी, do you know anybody what is that? It is decided when there are two tribes, they have some fight. They were having fight for a long time, and they want to resolve that issue. What do? They give their girls in exchange to settle that issue. तो उसमें आपके साथ ये नहीं देखा जाता what is the age of the women. It could be a newly born baby, it could be an old age woman, or it could be unborn baby whose fate is decided before birth even. But we will see what is happening currently in our country. The extended family system, role of in-laws in daily lives of women represent major issues and stresses. This is reported in a study in World Psychiatric Association 2004 by our very famous psychiatry, Madam Uneza Niaz, who is a leader in women mental health. He has done a tremendous work on women mental health. A large study at Tina Post Medical Center, Karachi, in 1990 showed that twice as many women as men sought psychiatric care, and the most of these women were between 20s and 40s years of age. So this also shows that the females are suffering more. Another 5 years study at Arakan University showed that out of 212 patients receiving psychotherapy, 65% were women and 72 were married. The consultation stimuli were conflicts with the spouse and in-laws. So these social issues are the basic reasons for problems as well. A study on stress and psychological disorder in Hindu Kush, mountain of northwest frontier province of Pakistan, showed a prevalence of depression and anxiety of 46% in women as compared to 15% in men. Why I am showing these figures to you? Because I just want to make it clear to everyone, if we don't have these figures, we cannot decide about the services, how to develop these services, and why do we need these services for specifically these areas and this particular group. So most of you are sitting as a researcher, you are going to be the leaders of the time or in your field. You have to do these researches in order to get something from your policy makers to devise certain things for their help. A study on suicidal patterns showed that the majority of the patients were married women. The major source of suffering was conflict with husband. With husband and conflict with in-laws. In the same study we conducted at our department, we studied the demographic profile of the patients who attempted suicide, and we found out that the number was more of females. It was around 73 and men were 27. I have just received a slip that I have to conclude it earlier. So rest of the things I'm just going very quickly. The rest of the things are violence that the females are facing. This is another issue, domestic violence. And domestic violence among married female psychiatric patients. We conducted a study over there and we found out that 22.6% were facing domestic violence. Higher prevalence of anxiety, depression, PTSD, post-traumatic stress disorder and substance abuse is found in women suffering from domestic violence. So women not only face these issues, they also face the stigma. Stigma is, what is that? See? Sorry? Okay, fine. Sort of disgrace, people start labeling them. So that is why they are also facing, if some female is facing some psychiatric issues, they don't come for, they don't seek help because of stigma issue. Work stress we have already discussed. What more is needed in this domain? WHO has recommended certain effective promotions of mental health, how to promote mental health. So what is required is to reduce any type of devaluation or discrimination of women's status in society, to decrease women's exposure to risk factors through education and legislation. Legislation is already, alhamdulillah, has been done in our country, as I'm going to show that. To involve women in decision making, not just in health treatment, but also in other aspects of their life. To ensure that any treatment towards women's mental health is obtained on the basis of informed consent, we have just discussed in ethics. Dignity and confidentiality should be ensured to strengthen social network and communities to enable them to provide practical and emotional support. To preserve and strengthen social capital and public good and reduce income inequalities. A model of care was designed by Mr. Morrow and Chappell. I just want to barriers को तो मैं उसको नहीं touch करूँगी, but I would say कि what is needed. The provision of child care facilities and nursery school with the services of the women, which are already in most of the places is done, but most of the time it is not provided. And the most important thing that I would like to focus is the availability of mother and baby unit with inpatient care. For those patients who are suffering from postpartum depression, psychiatric issues, they need this thing, so that they should be taken care of. So let's move on. Primary care में हम क्या कर सकते हैं? First step is to improve mental health treatment, is to increase awareness and provide training to general practitioners in their areas. Need for extensive undergraduate education is thus important. We are just teaching you behavioral sciences and few lectures of psychiatry, which is not going to help us when we want to improve services for women mental health. So we would request that the number should be, the timing should be increased, the lectures should be increased. There is growing need for training clinical psychologists in different psychotherapeutic modalities. The large cities, or we can say the urban cities, are lucky to have psychologists, but the rural areas don't have, they lack these issues. So we want that they should be, the people should be, we should train them and they should go to work in these areas as well. Community-oriented mental health services should be devised for female who are suffering from psychiatric disorders. Community day centers staffed by women to provide safe, confidential, and open access services. This is very important because we want to ensure confidentiality. We want to give them comfort so that they could come up with their issues and discuss things. Okay. There has been little attention to special rehabilitation needs of these women, which is also required. Equity of access and care should be ensured. Data and research is required in this field to develop further services and how to go about it. What has been achieved so far? Let's see. Awareness and training program. We are engaged in these kind of activities. We were training the primary healthcare workers, and we conducted with the Punjab government several programs like training of trainers of non-communicable diseases and well women clinic doctor for priority mental health disorders. So we can conduct more workshops like this to improve these things. Let's see. So there are very few number of trained psychiatrists. We need more. So we would like people, students, and we would like to encourage them to join psychiatry and help us in alleviating the sufferings of both female patients as well as male patients. So what I was talking about the customs, जो मैंने अभी बात की थी कि उसके अगेंस्ट क्या क्या हुआ, गवर्नमेंट ने जो कुछ किया, the protection against harassment and women at work. This Act has been launched in 2010, so they can get refused through this. So legislation has been done for these things. Mental health professionals. Acid Control and Acid Crime Prevention Act has been enacted in 2011, which was the females were facing this issue badly. So we should know about the laws, the current laws and the local laws. How could we help the patient? They can defend themselves. Prevention of Anti-Women Practices Act 2011 for prevention of customary practices such as giving a female in marriage or otherwise in Batla, Sula, Valni or Savaras, depriving women from inheriting property, forced marriages and marriage of females with the Holy Quran. So these laws deal with these issues. Protection of Women Criminal Laws Amendment Act 2006 makes a rape criminal offence punishable with death or imprisonment for not less than 10 years. Mental health professionals have worked closely in developing treatment guidelines for mental health issues of local population of Pakistan. Treatment of reproductive health problem has been addressed in a holistic view, and we have developed guidelines for women mental health as well. Thank you very much for your patience with me. I'll try to be brief. Is there any question?